Hi folks, I've asked the Deputy Chief Medical Officer, Dr. Jenny Harries, to come here to Downing Street. Jenny, perhaps you could tell everybody what are the symptoms of COVID-19 coronavirus?
So the main symptoms that people present with are fever, usually quite a high fever, and a cough. But we do get people coming with sore throats, shortness of breath.
And what should we do when we have those symptoms?
So the first thing is we want to take ourselves away from other people, just in case we have it, and prevent anybody catching it from us. But the important thing is that people who feel unwell and have symptoms stay out of the way of the health services to start with, till we work out what the problem is.
So that's our advice to people who think that they may have the symptoms of coronavirus, is to stay at home. Is that right?
Is to stay at home. Effectively what you're doing is isolating yourself, taking you away from other people, just to reduce that risk of transmitting a disease, of infecting somebody else.
People think they've heard this lots of times, but could you explain one more time why washing your hands is so important?
So there are two sorts of things we should do really. Washing hands is one, and catching coughs and sneezes with a tissue is the other. But for the washing the hands, this virus spreads with droplet spread and with what we call foam mites. So effectively, if the virus drops on the surface and we pick it up and then we touch our eyes, our mouth or our nose, we can become infected. So of course, if you wash your hands very frequently and thoroughly, for at least 20 seconds and much more frequently than we normally do, you will then reduce that risk of infecting yourself. So it's a really good protective mechanism.
And who are the most vulnerable people in your family or in society that we should particularly avoid getting infected?
It's still quite early days in our understanding of the disease. Children seem to be, they get infections but not particularly badly. The ones we're really worried about are the older people. So those 70, 80, and above, and people who've got chronic conditions, so things like heart disease or some respiratory disease.
Because the reality is that most people won't experience a major disease, it'll be a mild, moderate illness, but it can be more dangerous for people who are much older or who have pre-existing conditions.
Yes, so we really do need to look after our elderly people, our relatives or neighbours perhaps, and help them stay at home, helping them with shopping and that sort of thing if they need to stay away from other people. But for most people it really is going to be quite a mild disease. Most people get a few symptoms for the first 2 or 3 days and they're usually over it by a week.
Tell us about the value of wearing face masks. You see face masks around the place. Is there any point to that?
If a healthcare professional hasn't advised you to wear a face mask, it's usually quite a bad idea. People tend to leave them on. They contaminate the face mask and then wipe it over something. So it's really not a good idea and doesn't help. However, if you are a patient and you've been diagnosed with symptoms with coronavirus, then you may be provided with a face mask then, and that's a good thing. You're protecting other people in your vicinity.
And it's noticeable that there are some countries where they've banned big sporting events and they've stopped mass gatherings of one kind or another. Tell us why so far the medical advice in this country is not to do that.
In this country we have expert modellers looking at what we think will happen with the virus, and we've looked at what sorts of interventions might help manage this as we go forward, push the peak of the epidemic forward. And in general, those sorts of events, big gatherings, are not seen to be something which is going to have a big effect, so we don't want to disrupt people's lives on doing that.
Right, there's obviously people under a lot of pressure, politicians, governments around the world, a lot of pressure to be seen to act, so they may do things that aren't necessarily dictated by the science.
So as a professional, I'm absolutely delighted that we are following the science and the evidence. There are other things that we can do in this country, and the timing of that is really important. We need to get the timing, firstly on helping to stop the spread, continue to contain the virus as much as we can, but then particularly for our elderly people to find exactly the right point to give them advice.
And the timing is very important, isn't it?
It's critical, absolutely critical. If we put it in too early, we'll just pop up with another epidemic peak later on, and if we leave it too late, we'll have missed the boat. But because we have such brilliant modellers, we're pretty confident we will know the right point. We've got very clear advice about when we should intervene, and that's exactly what I think we should do, which is what we're obviously advising you as the government.
Thank you very much. Well, Dr. Jenny Harries, Deputy Chief Medical Officer, thank you very much for coming along to Downing Street this afternoon.
Thank you.